Hey, everybody, welcome to the Better Wounds podcast. We dive into all things cosmetic surgery, recovery, healing after your cosmetic procedure, your plastic surgery. I'm Heather Flexer. I am a dedicated wound care specialist helping folks heal when you have a little bit of a complication like a wound. So, today in this Get Ready With Me series, I'm joined by Nurse Afia with Monada Aesthetics in the Bronx. So thank you, thank you, thank you. We've been like hanging out in the same post-op circles for a minute. I love the content that you put out there. We
Thank
know
you.
each other a little bit from like one of my previous
Appreciate it.
guests, Ty Brown, and csltherapy.org. If you don't know, go check it out. There's lots of info there. But Nurse Sophia, I love your style.
Thank you.
You're a straight shooter, just like I am, and I love it. I've learned a lot like watching your videos, so I hope people go check you out and get some knowledge.
I hope
Um,
so too. I also, I refer a lot of clients to you because at a certain point of wound care, I feel like if you're not a wound care nurse, like we sort of just lose knowledge that way. So I really appreciate you being available and making your knowledge, just widely known for especially some of my clients that I've had to refer you to. And I feel like they have had a great experience with you, but also just healing better and healing appropriately because we get a lot of funky wound care instructions from some of the surgeons. So I thank you for that.
yeah, thank you. I appreciate it. I mean, it's always a pleasure helping other folks out there in the post-op space. Like, not everybody, we all come with different backgrounds and knowledge and everything. And it's like just this little piece. And if I can help, anyone's clients, I'm like, I want everyone to like, for the provider to feel more confident, for the client to, like sometimes it's just like, I don't know, ask that lady. And I get plenty of DMs like that. I'm like, okay, great.
Yeah, no, you're definitely you're a gem in the industry. We appreciate you.
Thank you. Um, so what I really want to talk about is this early post-op care, right? Um, those first couple of days when you go home and you're like, oh crap, what'd I do?
Mhm. Mhm.
Like what
Mhm.
happened? Because I
Mhm.
like the packet of information I got, I would be like, yeah, it's gonna be no big deal. Like you see people on social, like no big deal, they got it handled. I know it's not gonna be like that, or not quite like that. But
Yeah.
yeah. So I know one of the big things, the topics that's out there, people use drains, people don't use drains. But
Mhm.
if you're having a big procedure, chances are you're going to have a lot of drainage and they're going to collect it in a drain
Yes.
and they're sending you home with one.
Yes.
Yes. And you probably see people at this stage sooner than I do, right?
Yeah. Sure.
Yeah.
Yeah. I do.
So
Um,
are
the
they get,
drainage life.
yeah, yeah.
Yeah. So with drains, they are not as complicated as they may seem. Um, so the doctor or the surgeon, whatever they're most comfortable with, is what a client should go with. If somebody's not comfortable using drains, then let the surgeon do that and don't try to coerce them into doing something else. If they are comfortable using drains, don't go into their demanding that you don't have drains because that's the way that they work. As far as the home care itself goes, it's pretty easy making sure that you don't tug on it. So making sure it's secure. Amazon has those like lanyards that you can wear, like a belt, fancy belt.
Hmm.
You don't got to do all of that. Most of the
Uh,
time.
they have come with
No, I
clips,
mean,
right?
yeah, that's why I say they come with clips, so you can clip them wherever you need to clip them. You can use even if they don't come with the clip or somehow you lose it or it breaks off, you can take a safety pin and put it there and, just clip it somewhere. It's fine. As far as the drainage goes, we typically don't like to take them out before you have 25 mLs in 24 hours, just because you have an increased risk of developing a seroma if you take the drain out too soon. And nobody likes aromas.
Yeah, that was
They
definitely
can,
something else I want to talk about. Yeah.
yes, aromas can be tricky, and they can be chronic and they can be recurrent. So that's not something that you want to start off with, because they don't always collapse. The skin doesn't always collapse down, and then you run into other problems with that. The other thing with drains is not to try to take them out yourself. And I say that because I see a lot of people on YouTube taking them out. Great. If it happens for you and it works well, then no harm, no foul. But I have seen some get stuck before. And so when they get stuck halfway out of your body, you're introducing bacteria and things that could lead you to an infection. So that's why I always advocate for people to get them taken out by a professional, because if they get stuck, there's certain maneuvers and things like that we can do to get it out. Whereas you'll freak out at home. And then you go to the
Yeah, I don't
emergency
want to.
room, and then you freak out in the emergency room, it's just bad.
Yeah, yeah,
Like,
yeah. But that isn't even really like an emergency room type. Is
it's
that
not,
like that's not like an emergency. They're going to
it
think
is
you're
not.
crazy.
It is not, and I work in the emergency room, and I've seen stuff like that come in all the time. And then it's like it sounds like an emergency to you, right? But it's not an emergency to us, who are people getting gunshot wounds and heart attacks and stuff like that. Your drain is not an emergency to us, so you're still going to be sitting in a waiting room or the emergency room freaking out for another 6-7 hours, maybe, while bacteria is just like harvesting itself in your tissues, and that's not something you want. So that's why I'm like, just don't do it by yourself. Just get somebody else, get a professional to do it.
And like
Better.
if you're local to your doctor, they're probably having you come in to have it done there. But
Mm-hmm.
obviously, people are traveling to get their surgery. Usually,
Yeah,
they're staying, around for a little bit if they're going far for their surgery. So they're probably getting it done there. But then we're also seeing people draining for a long time and being sent home with them.
true. The longest I've seen somebody have one is a month. And obviously I don't think many people are staying, out of town a month when they go out of the country or, out of the state for surgery. They don't stay that long. Um, I have seen some surgeons send people home with home care instructions on how to take it out, and that still puts you in a situation where I just described prior. Um, if they do happen to do that, what I would suggest is that you set up a post-op appointment with the surgeon, either like a telehealth video thing, so they can watch you take it out, and then maybe if something does happen, they can instruct you to do it. Just so you have a provider or somebody that's knowledgeable about it there with you while you're doing it. Even if they're not right there with you, they're there with you while you're doing the experience, and then maybe they can help you out if you incur any issues.
And sterilize the heck out of everything.
For sure.
Yeah,
Betadine, not
yeah.
hydrogen peroxide. People know hydrogen peroxide. Betadine, alcohol, even saline is better than hydrogen peroxide.
Mm-hmm. Yep. And we're talking about not for the wound care, but for cleaning everything in order to take the drain out. We're not talking about like using those, all that stuff in an open wound, but this is like specific
Yes.
for like, this is a procedure. This
Yes.
was,
For the
yes,
removal.
yes, this is a
Yes.
procedure. And then there's also post-op, like I know you do drain removal. So there are some providers that do it, but normally that's like you're a nurse. That's like a nurse. I don't really know like licenses and who should be doing what, but
No,
not
so
everybody.
actually, if we want to be quite frank about it, there, because you can tell people to do it at home, there's not really a lot of regulation around it, sadly. So you have some studios that don't have people who are educated or knowledgeable enough to take the drain out, and then you run into the situation I just said prior.
Yeah.
Everybody's freaking out. It's like, oh no, it's stuck or something's happening, and everybody's freaking out.
And then,
So
not a good
yeah,
scene. Yeah, yeah.
yeah, no, it's not.
Yeah,
It's
yeah.
really not.
Right. So even like I've had some people and I'm like, I don't know, try urgent care, try your primary care provider, try like somebody else if nobody else will do it.
People don't like to touch those things.
I know.
So I worked in various healthcare environments. They don't like to touch those things. So you'll go to urgent care and you'll pay a $75 copay or something like
And they
that,
won't
and
do it.
they still won't do it because they're like, well, what is this from? What is this for? They won't do it. So like I said, the best thing if you can't get to a provider physically is to try to set up something telehealth, because it's better than you doing it at home and freaking out if something happens. The other thing I want to caution people about: when you are emptying your drains, do not hold them over the toilet, because it's a lot of bacteria around your toilet.
Like coming
You want to
back
put it
out.
into a Yeah, you want to put it into a cup and then a clean cup, and then dump that out. And you also
Yeah.
want to just keep a measurement of it, of course.
Oh, I think I saw, this is just an aside. I think I saw one of your videos once where you were trying to teach people how to clean themselves with like a squeezy bottle, and you're like, you put soap and water and you sit over the toilet and you give yourself a good rinse, right? With soap and
Mhm.
water, right? And I recently was dealing with someone at the hospital, and it was like a very similar conversation, and I'm like, well, she couldn't reach like to wipe, and I'm like, okay, we'll get like a squeezy and soap and water and squeezy.
Yeah.
And she was like, well, I need a specialized device for that. And I'm like, what are you talking about? It's like,
No,
how about
Gatorade bottle.
A Dawn dish soap thing? Like, just, I don't know, like if we throw away tons of squeezy bottles all the time, just clean it and clean yourself up. Like, it was very funny.
Well, I hope she found it to be good advice or some
Yeah.
usefulness to
Yeah.
it.
I was like, no, no, you probably throw away a bunch of those like a week. Like, just find one and use it and then throw it away
Yes.
and get a new one and clean it and start
Yes.
over.
Yes. Recycle, recycle, recycle. That's what we like
Why
to do.
not? Right? Um, So, with the drains and the leakage, right? Sometimes
Mhm.
you're going to have a procedure like I'm having lipo, I'm not going to have drains there, but there'll be incisions. They may or may not be like stitched to closed or anything like that, but there's going to be leakage, right?
Yes. Yes.
Especially in those first like 24, 48 hours, there's going to be leakage. It's just going to happen. That's part of the thing.
Yes.
When do you worry about how much leakage is coming out in the beginning?
So in the beginning, just because of the color of it, people freak out because it's red, right? So everybody's like, "Oh my God, I'm bleeding to death," but you're not. Most of it is tumescent fluid mixed with your blood, which we call T interstitium. So it's not something that you need to freak out about unless you start to feel dizzy and you start to, maybe your heart rate starts to elevate, or you start breathing really fast. And I say breathing really fast, but that's separate from you being anxious. Like, if you're just sitting around and you're watching
Looking at
TV,
fluid. Yeah.
and then
Yeah.
all of a sudden you're like, "Oh my God," like I'm like, my chest feels heavy. I'm, having tachycardia, which is a high heart rate, or I'm starting to breathe really fast, or I'm starting to feel really dizzy, or your level of consciousness starts to go down where you were up and now you're like sleepy all the time. You may be losing too much fluid, and that's when you want to go and speak to somebody about it.
Yeah. I
Yeah,
mean, if you
but
were
it
in the hospital, they would be giving you fluid. So you've got to
correct.
be, if you're home, you've got to be taking in fluids, and, you can't
Yes.
just sleep through it, and you can't just be taking all those pain meds and sleeping the day away. You got to get up and get moving. You got to take fluids
Yeah.
in.
It
Yeah.
can be hard though. It can be hard to distinguish when you should be scared or when you should be nervous. I don't want to say scared, but when you should be nervous about it can be a little difficult because you did have anesthesia, so that could make you a little loopy too. Um, and the other thing with the fluid that comes out, depending on how much your doctor uses. So there are some surgeons that don't use a lot of tumescent fluid, and so you wouldn't expect to have a lot of fluid out. But if you did have a lot of fluid out, that should definitely be alarming, especially if they only use like a 500 mLs or something like that. That should be alarming because that means something else is happening. Versus somebody who may use like a liter or 2 liters of it, then that's what's going to come back out is a liter or 2 liters. And it tends to look worse on wee wee pads or your bed sheets than it actually is coming out of you. It looks like it's much more and it's not. But paying attention to your body and knowing like, oh, you know what, I've been sleeping a lot. um I've been trying to be active, but I've been sleeping a lot, or I've been trying to be active, and every time I do get up, I'm tired. I feel like I'm so dizzy, I want to pass out. Those kind of things you want to definitely pay attention to. At my studio, what we do, I just had to do it last week, actually, Heather. It was crazy. A client came in and she was super dizzy. Like she could hardly, I have steps. Unfortunately, it's the Bronx. So in my studio, there's steps. She came up the steps and I could just tell, I was like, oh no. I was like, I do not feel comfortable doing any kind of treatment on you until you get some fluids. And she couldn't really take fluids because her uvula, unfortunately, had got snagged. Whatever the anesthesiologist did, he like ripped it.
Oh,
So she didn't want to drink or eat because it was not comfortable for her, right? So she was already dehydrated, lacking fluids, lacking intake. I made her get an IV treatment at the studio before I did it because I'm like, I don't feel comfortable doing it. It wouldn't be smart to do a post-op treatment on somebody who's dehydrated. But I've had to do it for a few people. I actually advocate for people to get IV fluids afterwards because you don't have to worry about drinking. You can be hydrated intravenously.
yeah,
So something you
yeah,
might want to think about if you're close to somebody or if you have a nurse or a doctor, because even some of the doctors are doing it, can come to where you are and give you some IV fluids. I definitely would encourage that.
yep. I got an appointment booked. Yep.
Look at you
I'm
doing all the right
trying.
stuff.
I'm trying. I'm trying. What do you think I'm talking to everybody? Um, so I'm having a breast procedure and I'm assuming there's going to be tape on there. Tape's like another big thing, right? So people come home with the tape and I see like, I get concerned messages all the time, like they pulled the tape off and a little scab came off and like, oh my God, it's a wound and what am I supposed to do?
Mhm.
So tape, the surgical tape, obviously we're saying all this stuff and it's like, yeah, listen to your doctor first, like follow doctor's orders. We're just giving you the like our background, like our 2 cents about all this stuff. But the tape, you pretty much leave that on unless it like gets gross or falls off on its own.
Yes. So steri strips is what you will leave on until it falls off on its own. What the big thing I find with steri strips is that, especially if you have any long incisions, like you have a breast surgery or you have a abdominoplasty, because you're facing away from the shower, it takes a longer time for those steri strips to come off if you're trying to keep the front of you absolutely dry. So what I typically say is just make sure when you're taking a shower, just so the steri strips can have their natural life cycle and you're not elongating it, right? Let the water fall over you. So you can still get them a little wet. You don't want to peel them off. You don't want to scrub at them, but you do want to allow them to get wet because they do need some kind of moisture to come off of you eventually.
Yeah,
Those fall off around set between day 7 and 10, sometimes even 2 weeks, but 2 weeks is a little bit long
that would
for
be a
steri
lot.
strips to be on.
Yeah, yeah.
Yeah, that would be a lot. That would be a lot to be on.
But
But yeah, don't be
steri strips is
stressed.
different than that like wall, like people come in there like all taped up with that like
With the beige surgical tape
with
and
the
the
beige like the real that tape.
yeah.
Yeah.
Yeah, that can be a little nasty. It can be gunky. So
Yep. It might
you
smell a
definitely
little.
it definitely smells a little bit, especially if you leave it on for a long time. When it's ready to come off, you'll start to see it peel, and then you still want to take some kind of moisture to it. So you might want to remove it in the
In
shower
the
so that you
shower.
don't
Yeah.
peel off a scab or something. Scabs are there to protect you. So you don't want to peel off a scab while you're pulling off the tape. So you
Yeah,
want to
yeah.
be careful about it. But yeah, I would definitely wet it before I did it. Don't wet it with just any old thing. Use some antibacterial soap while you're in the shower. And then
Yep.
take it off gently. And if you can't take it off gently, leave it alone because it'll fall off on it. It will come off.
Yeah,
Maybe
like
the next time
just
you take a shower.
keep letting it get soaked up and it'll if it doesn't come off during that shower, it'll come off on the next one.
Yeah.
Yeah.
And then make sure you always look at your wounds after you take that tape off, just so you can see if something did, like if a scab did come off or if there was something that was going on underneath the tape. I always advise people to look at themselves so you can, say this is the day that it happened, this is what I'm looking at, and then maybe you can compare it to 3 days later to see if it's getting worse or better, just
Yep.
to keep an eye on your skin because that's how things start to get
Hmm.
funky.
Yeah, and if we're
That's why I have
talking
to refer people to you because I'm like, what did you do? You gotta talk.
I know I've seen people like just go home and shower and like pull the tapes off like on the first one and I'm like, no, no, wait. I don't know if you were supposed to do that. Or and then I've also seen people wear tapes forever. Like
Mhm.
just like thinking it's going to keep everything closed and there's like a certain point when you just
No.
it's really not, it's just there and it's just like in the
Yeah.
way and
Yeah.
then your
And that's not
skin's
the tape
not
that you want
breathing.
to use. That's not the tape that you want to use anyway, even if that were the case. You know what, Heather? I had somebody come in the studio the other day with some freaking electrical tape on their body. And I was like, ma'am, I'm
Where'd you get
sorry.
that
Like,
tape?
It was electric. It was like straight up electrical tape, like straight up electrical tape. And I was like, "Ma'am, I understand that times may be hard. We all got a financial crisis going on, but the Dollar General sells regular skin tape. So the type of adhesive that you use on your skin while it's so delicate after anesthesia is definitely important because your skin is thinned out by anesthesia. Some of the products that they use, some of the medications that they use, you don't want to be putting any old adhesive on your skin. That ain't what
Yeah.
you want to do.
Hmm. Yeah, and
So
that's like a
please.
weird property tape too. Like it's like yeah. And I saw someone once go like around like her entire waist, right? And I'm like,
No.
it's kind of like a tourniquet. Like,
Yeah, she was
yeah.
binding herself.
Yeah, I was like, I don't even like I definitely don't like the binders and things. Like I don't like where it's like literally hitting right where the tummy tuck incision is and it's just getting all rubbed up. Like
Yeah.
not a good, yeah.
No,
Just
no,
take a
not
minute and think about what you're actually doing. And if it doesn't feel right and it doesn't like seem like it sits well, maybe don't use it.
yeah. It ripped her skin out pretty good. And I was just like,
Oh,
this is not okay. It's
poor
not
thing.
okay.
Yeah. Yeah, yeah. Hopefully just keeping it moist and covered and clean and hopefully it's all good.
That's not
You touched briefly on seromas.
Mhm.
That's a huge thing I know everyone is worried about, even if they have like a little bit of swelling. Everybody thinks it's a seroma.
Mhm.
Yeah.
Yeah. Yeah.
I know that like the treatment, there's treatments for seroma, but compression is the place to start. Obviously, we can drain them, but a
Mhm.
lot of times we're trying compression first.
Yes.
Yes.
You definitely want to try compression first because seromas, again, they can be recurrent and they can be chronic. So what I find is that people who don't have proper compression, not a size small. I always tell people to make sure that don't pay attention to the size, pay attention to the fit. So if you don't have proper fitting compression, then your seroma will reoccur regardless of how many times we drain it. So there is compression, which I definitely try for anything that's smaller than like maybe 2 inches or so. When it starts to become like most of the seromas that I see are in the abdomen. When it starts to cover 2 quadrants, that's when I'm like, let's just go ahead and needle aspirate it because it's pretty large and you don't just want it sitting there. There have been times, of course, where people don't want to do the needle aspiration and then we'll try, so, try compression. And then the next time they come, if it's still the same, then I encourage them to get a needle aspiration. And then if it's smaller, then I'm like, okay, well, let's keep compressing because compression is working. You don't like needles. Let's make it easy for both of us, especially you. Um, so yeah, let's just go ahead and try compression. And most of the time, compression works. There has been one episode where a woman had to go back down to Florida for a while, um, where she just kept having seroma after seroma after
Oh
seroma.
wow.
She was at her doctor's office like maybe like every few days to get drained. Um, Special case. That was a special
Yeah.
case. That's not typical.
Yeah. 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 Yeah.
But
But
yeah, if you don't see that waterbed effect, it's just swelling. Like seromas are very distinctive. They have a characteristic called a waterbed effect. It's like a float. So you'll touch here, you'll see it wavy up here, or you'll touch here and you see it wavy up here. That is a seroma. Um, if it's not
they
wavy like
usually
that,
a little bit more defined? Like you can, it's not like swelling is
yes,
going to be a little bit more diffuse
more
and
generalized and
yep.
diffuse. Yeah,
Yeah. Yeah. Yeah.
yeah.
Yep. And some
So
of it's
I
just
don't.
like normal skin injury. Like you just had a major procedure. You had your fluids are all over. They're too much and too little all at the same time, right?
Mhm.
So it's all happening right under the surface of your skin and it's just going to look weird. And so sometimes you just need a little bit of time, but get that compression in there for sure.
Yeah, for sure. One of the doctors that I work with, he uses lidocaine. He uses lidocaine to numb for the drainage. That's not something that I do with my studio. However, I will tell you honestly, I don't have many people complaining of pain. It's just the initial poke. I get the fluid out, and that's the end of it. I just feel like the lidocaine thing because the lidocaine burns, so I gotta burn you before I
Yeah.
It's like you're gonna take this pain, you want to take just this little prick right here. So I know some people use lidocaine, I just don't. But we get
Yeah.
this aromas taken care of.
No
So
problem. Good to know. So they can look for you if they're in the tri-state
yeah,
area if they need help with those
yeah, sure.
drains and those seromas and all that post-op care.
Yeah, that's not something you want to go to the emergency room for either, because all they're gonna do is
They don't
do
care.
an ultrasound on you and tell you to go home. They see it's aroma and tell you to go home. They're not even gonna
No.
tell you that you need to compress. They're just gonna be like, "Ah, we see it's aroma. There's nothing we can do for it. Here's your discharge papers. Bye."
I have
So,
had some people like I will get some wound pictures. Like I ask for, when someone's reaching out to me, I'll ask for pictures, right? Because I want to know if I can even really help you, or do I need to send you on to someone else? And sometimes I'm like, no, ma'am, you have to go straight to the ER because it's like they're like, oh, it's a small little dark hole, and it's like I'm like, no, no, that's a fully dehisced wound that I can see into, and the rest of it looks inflamed and green and all the not things we don't want to see. So
mhm.
in that case, there's like nowhere else for you to go because we don't want you going septic. So yeah, when we say things like go to the ER for real,
Mhm.
because we're not going to send you there if it's not
No,
not
we're
not
not.
for real.
No, not at
No.
all. And the surgeons there are general surgeons. They're not going to call plastic surgery in for you. So at that point, when you come to the emergency room this is just me speaking as an emergency room nurse,
Yeah, yeah,
not as
yeah,
post
yeah.
op. But I just want you to know when you do go to the emergency room, our duty is not for your aesthetics. Our duty is for your life and for
Yeah.
your well being. So we're going to worry about your infection, not about how you look. So you may come out of there not happy out of the hospital. You may come out of the hospital like, oh my God, I'm so swollen. I've developed this aroma while I was there. I'm not compressed while I was there. None of that stuff matters to us. We're trying to save your life. So please don't get mad that we're trying to save your life and we're not worried about, how you look. You got to figure that out some other time. But
Yep.
you have to be alive to look good. So that's what we're worried about in the emergency room.
Absolutely. Yeah. Yeah, yeah. And we've got in this like early recovery stage, we're trying to make sure like we're good. And we are staying out of emergency room. So we're looking for, you have these wounds, this trauma, like you're looking for fevers, pain, not feeling good, like you said, like you're going to pass out, flu-like symptoms, all that kind of stuff is like the early not doing well.
Yeah.
Yeah.
Yeah. Yeah. I encourage everybody to get a thermometer at home. If you don't have one, you need one, especially during the first few days. And regarding that, I know this is like I'm digressing a little bit, but it'll be quick. You will have a little bit of an elevated temperature when you come out. It's just an inflammatory response, but it shouldn't be sustained. So if you still, and it shouldn't be a high fever either. But you may have a little bit of increased temperature the first few days. That's completely normal whenever you have such a big injury like that, like surgery.
Yeah. Yeah, yeah. Absolutely. Well, anything else you want to drop knowledge bombs on us about?
What else? I don't think so. You know, it's lots of stuff we could talk about, but there's IG pages for that, and then you can go and look at that on your own time. But I am always here for your resource, Miss Heather, because I
No,
can't wait to
thank you.
see what you're gonna look like.
Me neither. So, where can folks find you?
Ah, yes. So on my IG, of course, do lots of education there. Is NzuriMonada underscore aesthetics. Or on TikTok, it's NzuriMonada Aesthetics. Or you can find me in the Bronx. We are the best in the Bronx, VX. You can find us on Google. Of course, we're on Williams up here in the Morris Park area of the Bronx. We're accessible by the 2 and 5 train, so everything is pretty close. And we got good music too. Don't forget that part. You need good
Okay.
music. You need good music while you're taking care of people. You have to have good ambiance in the studio.
Well, we
Mhm.
might have to do an in-person video.
I'm here. I'm here. If you come down to New York, I got you seriously. You are I will take care of you with everything that I have.
All right. Thank you so much. I appreciate it.
Thank
Give her a like and
you.
a follow and a share, and we'll see you soon.
Yes, ma'am. Later.